Welcome to Managing MDS. I'm Dr. Aziz Nazha. I'll be discussing an abstract at the American Society of Hematology meeting talking about a personalized prediction model to risk-stratify patients with myelodysplastic syndrome. So outcome of patients with myelodysplastic syndromes are very heterogeneous, with some of the patients have indolent disease and their survival is measured by years, while others have very progressive disease, profound cytopenias, and risk of AML transformation, and their survival is measured in months. Accurately predicting the overall survival for those patients is clinically very important. So from the patient standpoint, it's very important because it kind of set the expectations of their disease. From physician standpoint, all our recommendation and treatment guidelines are based on risk. For patients with lower risk disease, we treat them completely different than patients with higher risk disease. There have been several models that can risk stratify patients in myelodysplastic syndromes. Of course, the most commonly used one are the IPSS and IPSS-R. But we have recently shown that there is a significant amount of heterogeneity in the prediction of these models. In other words, what we actually predicting for the patient and what the actual survival of the patient is completely different. That's led us to think, is there a way that we can build a model that can precisely predict the outcome of MDS patient, and the outcome will be very specific for each patient. So in order to do that, we took clinical and mutational data from our database at the Cleveland Clinic, and that was comprised of the training cohort, and then we acquired a validation cohort from 5 other US institutions that is consistent with the MDS Clinical Research Consortium. To build the model, we used machine learning algorithm, that's the random survival forest. And this algorithm will provide a personalized prediction that is specific for the patient. We train our model, and then we validate it in the validation cohort. And what we're able to show that this model, in terms of predictability with the C-index, outperform all our current models, even when we added molecular data to them. So we believe that this model may change the way how we think about prognostications in MDS and other hematologic malignancies by building a personalized prediction that is specific for a given patient. Thank you very much for viewing this activity.